That regionalism extends throughout the state of California and beyond. We have had the deep collaborative spirit advance now in states large and small all across the United States, but none stronger than the relationships we have formed in Washington State and the state of Oregon. We just sent out a joint statement of a shared vision for a process and protocol, a framework, we refer to it, for reopening, not just within our states, but more broadly as a region. I don't want to overstate this vision. I don't want to overstate this framework, and I don't want to understate the imperative of meeting this moment by continuing to practice appropriate social distancing and practicing physical distancing so we can continue to bend the curve. But we are at a point of time where, not dissimilar to the announcement that was made an hour or so ago on the East Coast, that we're beginning to socialize conversations we've been having over the course of many days, in the case of the Oregon and Washington governor, into the beginning of last week, where we began a process of establishing more formally what it would look like and how we could begin the process of the kind of incremental release of the stay-at-home orders that advanced the fundamental principle of keeping people healthy, keeping people safe, using science to guide our decision-making and not political pressure, and continuing to do what we can to share our best practices and share our resolve and ultimately advance the kind of results that everybody is expecting. We look forward to collaborating further with other governors along the western states, but we look forward, in addition to that, to continuing the collaborative spirit that extends well beyond just the west coast of the United States, forming perspectives and opinions, sharing best practices, and ultimately advancing the cause that unite all of us, and that is the cause of reopening our economy and doing so in a safe and strategic and responsible way. And to that end, I want to be very specific. Tomorrow, we will lay out our California-based thinking on that effort. For weeks now, I've been previewing that the state of California is putting together a bottom-up plan, a framework for targeted interventions and easing of restrictions in the state to allow us to toggle between approaching issues on the population basis versus on an individual basis. We're going to lay that out, as I say, as detailed a plan as we can at this stage tomorrow at the noon press conference. But I just want to acknowledge and thank the governors of Washington, governors of Oregon, Governor Brown and Governor Inslee for their just ongoing partnership, their incredible support and the collaborative spirit that, by the way, goes well beyond just this moment. I want to just extend that spirit was on display at scale last year with the forest fires that we had, particularly in Northern California, where they brought down mutual aid engines from Oregon and into Washington State, allowed us to concentrate our resources in some of the hot spots in Southern California to address last year's wildfire season. So again, it's the spirit of collaboration, spirit of partnership, a recognition that this pandemic, the virus, knows no boundaries, knows no borders. You can't build walls around it, and you can't deny basic fundamental facts. And again, before I transition, we will be driven by facts, we'll be driven by evidence, we'll be driven by science, we'll be driven by our public health advisors, and we'll be driven by the collaborative spirit that defines the best of us at this incredibly important moment. What also defines, I think, the best of us at this incredibly important moment is to recognize that disparities persist, that disparities need to be addressed in real time, that are highlighted and that are exacerbated in moments like this. One of those areas is the well-being of our children. So much has been discussed about physical health issues and mental health issues. We were very pleased by the outstanding leadership and partnerships that we were able to form last week, where we socialized the details through our Surgeon General of resources that are made available to address the stresses and the travails many of us are feeling, and providing resource guides in a very culturally competent way on the basis of age and geography throughout the state of California. but the persistent issue of our children, particularly children in our welfare system, particularly children that are, quote unquote, at risk, remains a vexing challenge, particularly at a time when we have stay-at-home orders, which reduce and significantly limit the number of in-person visits as it relates to our Child Protective Services, what they're providing in terms of casework in real time, in person, that is so important to address vulnerable communities. When the schools are closed, that's another point of contact where people are able to make referrals based upon the interaction of children, the interaction to school nurses, to one another, interactions with our caregivers, not least of which, obviously, our teachers. Those referrals are down. Those in-home visits are down as a consequence of the virus. But what is not down is our guard and our commitment and resolve to work around that and work through that. And so today, we're announcing a $42 million effort, substantially supported by the state of California, $40.6 million of the $42 million direct statewide support coming from the leadership, the Assembly, and the Senate that have afforded us these resources to invest in building supports all throughout the state of California. And what I mean by building supports is along the following. We're tracking about 86,500 children within our system, about 59,000 specific to the foster care system. We want to extend supports small and large along these lines. Resource referrals, more amplification of our 211 system, more connection with the 211 call center to family resource centers, more support for our frontline employees, county-based employees, our partnership with our labor leaders at SCIU, perfect example of the incredible work that's done on a daily basis, Health and Human Service, all throughout the state of California to provide them more resources, more support, and more capacity to continue to do what we can. We're not just knocking on every door, to knock on those doors of those that are most vulnerable, and to continue the kind of telehealth engagement and virtual outreach, as well as phone calls to those caseloads, and to make sure that they have the support to meet the magnitude and the scale of our challenges. One of the magnitude and scale concerns we have is the number of our foster kids that are emancipated on a monthly basis. Roughly 200 young children are emancipated every month in the state of California. At this moment, we think we should extend the emancipation process, and we're providing resources, millions of dollars, to do just that, to extend the time where people can stay with their current caregivers and get the kind of support and food that they deserve. That's number one. Number two, we are providing additional $200 a month for families that are most at risk. Thousands and thousands of families will get the benefit of that contribution to help with food and to help with other incidentals at a time, again, of deep, deep need. We're blessed in the state of California to have an incredible director of our Department of Social Services, Kim Johnson. She's been helping put together this plan, working with our county partners over the course of the last number of weeks. Just reminding everybody, we're not giving up on our focus and our oversight and our legal responsibility to protect our children at this very difficult period of time. And I will ask Director Johnson to come up and fill in the blanks on other specific things we're doing, but I just want to extend a deep appreciation and compliment her outstanding work in putting together this package that goes out immediately effective today.